So can you describe a day in the life of the doctors in your discipline? Like, is it very hectic or is it chill or moderate? How is
Yeah.
it?
Basically, nuclear medicine, generally speaking, is not a very hectic department, generally speaking. But I'm studying in a place where nuclear medicine is very hectic. The thing is that, uh, and you asked about doctors. So there are two types of doctors who work in nuclear medicine. Basically, there are the residents and there are the consultants. So even for residents in like 99% of the nuclear medicine departments, it's like it's still early. Like you can have a very good work-life balance. Even in our, but in Tata Memorial Hospital, like there's a little bit more work because a lot of scans happen. There are like this is the place where maximum number of PET scans happen in the country. So there are some extra workload in Tata Memorial Hospital due to that. But still, you have to understand there are no night duties, practically no night duties, no emergency duties, no, like we have all Sundays off,
That's
all
great.
Sundays, and all major holidays are also off for nuclear medicine department. And in most places, it is uh, like an 8 to 5 kind of residency even. And as and you asked for a like how a day goes in a
Yes, sir.
in a in a life of a nuclear medicine like doctor, right? So when you're I just said that there are diagnostic and therapeutic
Therapeutic.
parts of nuclear medicine. So in when you're a resident, you will be posted in one of these usually. Like there will be a rotation of postings. You will be posted in PET scans, then another month you will be posted in SPECT scans, then you'll be posted in therapy units. So when you have therapy, you will be posted. We have OPs, we have therapy wards as well. So many people think that nuclear medicine people always sit in front of computers. So that's not entirely true. We also have other things to do here. So when you're a resident, you will be posted in each of these separately in most setups. But when you are a consultant, the majority of work will be at the moment. Majority of work are basically the diagnostic part, that is reporting scans, right? But when you are a consultant, you will also be doing OPs as part of your like your patient, the
Treatment.
therapy patients, right? So when you are a consultant, you have to do like both of them together. But when you are a resident, usually you get to do one at a time. But it will depend on which hospital you are doing your residency. In some hospitals like RMC, they are working under a particular consultant. So if the consultant is doing a scan one day, they'll do that. If they're doing both scans and therapy on the same day, they will also be part of that. So it will depend on which college you go, basically. But
That's
still, you'll be you can be free by evening
that is the
when you are
main
a
motto.
consultant. Yeah, you can be free by evening when you are a consultant. But when you are a resident, depending on where you
Posted.
are studying, depending on where you are, like in the which hospital you are doing your residency, it can vary from being free by evening or free by night. But you will not have night duties, so that's a good thing.